Thank you for coming. I'm Forrest Claypool, CEO, CPS. This is a lead information meeting. I'm going to let the subject matter experts do a brief presentation and then take any questions from anyone from the community or parent. As you know, we have started a school-by-school audit of every fixture throughout the system, and in order to identify any potential lead hazards and remediate them. I'm going to ask Jason Kierna, who's the head of facilities, to do a very brief overview of where we're at in that process. And Dr. Loff of the health department will also do a brief discussion of the general health implications of lead, whether it's in water, lead paint, or other sources, and then we'll be available to answer any questions. The water department is also represented here today in the event that there are questions related to that service, but we want to focus primarily on what we're doing in the audit process and also in our remediation efforts, as well as the educational aspects of the health aspects of lead. So I'm going to turn it over to Jason to give a brief overview.
Thank you, everybody, for coming tonight. Again, Jason Kierna, part of the Department of Facilities for CPS. Just wanted to give you a brief overview of our testing program and where we currently stand as of yesterday. So about 2 months ago, CPS took the proactive approach of testing water sampling and testing all approved devices for water consumption at all 529 of our school campuses. With the short amount of time that we had between 2 months ago and the end of the school year, and the fact that normal use conditions should be present when conducting the water sampling, we selected 324 schools based on two criteria. The two criteria were, the first was that the campus had a pre-K program, and the second was that the campus was built before 1986, which was the year that lead pipes and lead solder were banned. So currently, as it stands, as of yesterday, we have completed sampling at 307 of those 324 campuses. We've collected almost, or a little over 27,000 samples from 5,685 devices. Just to give a little bit of background about how we're testing, it's a sequential sampling process, which means that we're taking 5 samples, each 250 milliliters apiece, from devices such as kitchen sinks, water fountains, and any water outlet in those pre-K classrooms. To date, we have results back for 95 of those schools that we've tested. That's approximately 30% of the schools that we've sampled thus far, and 28 of those schools have at least one device with at least one sample above that action limit. Just to clarify about what happens when we find that, in every case, all of those devices, once we get that information, we've decommissioned those devices immediately and then started our resolution planning, which involves our design team, our architectural folks, and various other individuals from the facilities department to make sure that we're addressing the root cause of every single issue and taking every single issue as a unique issue and investigating it thoroughly. There's two other pieces to that, though, about the sampling process that I think are very important to paint the entire picture. So as far as results go, we've gotten 6,905 samples back when it comes to actual results. So we've collected a larger amount than that, but based on those 95 schools, that equates to 6,905 samples. And 124 of those samples have been above the action limit, which is about 1.8% of all the samples that we've taken in the results that we've gotten back. And then to further clarify on that, in terms of devices, we've tested and gotten results back for 1,553 devices, and 60 have come back with at least one sample above the action limit, and that's about 3.86% of all devices. As far as next steps go, we will continue our effort, our water sampling effort, when school resumes in the fall, and we're going to be looking at the next set of schools being 146 campuses that were built before 1986. That were built that were built before 1986 that do not have a pre-K program. And then after that 146 prioritized, we'll be looking at the final and sampling the final 59 campuses that were all built post-1986 when lead pipes and lead solder were banned. So that's an overview of the program, and now I'll pass the mic off to Dr. Loaf from the Chicago Department of Public Health.
Great. Thanks, Jason. Yeah, again, my name is Dr. Kortloff. I'm one of the medical directors at the City Health Department. I just want to restate something that Jason said, and that is that only a small percentage of all the samples that were taken, as well as a small percent of the fixtures that were sampled had evidence of elevated levels of lead. So that's certainly a good thing. And the second good thing, just to restate, is that as these fixtures, as these samples were identified with elevated levels of lead, these fixtures were decommissioned. So that takes away the source of lead exposure for children. So that's a good thing as well. I just wanted to say a few things about lead here in Chicago. First of all, it's been our experience as a health department that we've not had evidence in the past of children being exposed to high levels of lead as a result of drinking water. Instead, the most common reason that children are exposed to lead is through lead-based paint. Lead-based paint is found in older homes, especially older homes that have been poorly maintained. And as some of you know, lead-based paint was used up to 1978, the year that it was banned. So what this tells us is that there's because of the older stock of housing in Chicago, there's a lot of homes, a high percent of homes, in fact, here in Chicago that have some lead-based paint in them. And if the homes are poorly maintained, the paint can peel, chip, create dust, and that dust predominantly can expose small children who may play near windows or play on floors, and touch the dust with their hands and put their fingers in the mouth and be exposed to lead-based paint that way. So that's really the biggest source of lead exposure here in Chicago among young children. And not to say that this issue is not important, but just to say that our experience indicates that it's a lead-based paint that is a big problem here in Chicago. So with that in mind, I just want to let you know that we do have a fact sheet available here in the front that talks a lot more in detail about lead-based paint, and what parents, homeowners, and tenants can do to identify and prevent exposure to that lead-based paint. And then I also want to remind folks that if they do have concerns about children being exposed to lead from any source, that it's best to consult with their child's healthcare provider. The child's healthcare provider can do a simple test to determine what the child's blood lead level is, and if that blood lead level is elevated, again, our biggest concern is that that child might have been exposed to lead-based paint in the home. So if the child's level is elevated, we will send our inspector to the home. We'll do an inspection. If we identify any lead-based paint hazards, we'll work with the property owner to try to mitigate that and prevent further exposure of that child to lead. So if there are any questions after tonight, we do have our lead hotline. That number is publicized in our fact sheet. Would encourage you folks to give us a call if you have any questions. So with that, I'll turn it over to Forrest.
Thanks. Thank you, Doctor. Also, just a reminder that all the information on the samples, the testing, the results, and other information is available online at cps.edu/lead testing. So at this time, happy to take any questions either from myself or any of the other experts with us today. Yes, ma'am.
I have a question about decommissioning of the fixtures.
Yeah.
Is it based on the fixture itself? Because the piping itself within these older buildings are connected, and it may just concentrate to a certain. How are you assuring that it's not just that one fixture because of piping or solder or?
So to answer the question, through the sampling protocol, and especially through the sequential 5 samples, we're actually able to look at and make a fair determination about where, if there is a sample that comes back above the action limit, where that's actually coming from based on the water that's sitting in the device. So if it was the first sample, it would be closer, obviously, to the point at which the water comes out of the device. And if it's the 5th sample, that means it's probably closer to the riser or the pipe that brings the water up the wall. So in every one of those situations, part of decommissioning the device and obviously testing all of the devices in the school gives us a good indication of where the actual problem is, and decommissioning that endpoint device and ensuring that in certain situations there is no other device along that riser that's being affected in the same manner. We're able to decommission that one device and then go through our protocols of follow-up and really checking and thoroughly trying to figure out where the problem is coming from. But that's the whole point behind the 5 250 milliliter samples, so that we're decommissioning the correct device and understanding with a good degree of certainty where we need to go look first to try and expedite the fixes.
Another question.
Go ahead, sure, follow up.
When will the release of the names of the schools in the next round be released? I'm here just to hear things out, but also Lincoln School is right next to the Children's Memorial Redevelopment, and when the water was shut off, parents are concerned about how that might affect the water in the school. And I did speak to someone in facilities, Rob Leland, and he said that the water department has, under normal circumstances, when they're doing demolition, they have things put in place outside the realm of what's happening. So I'm just wondering, can anyone tell me if the water shut off at the hospital in close proximity, excuse me, to the school could affect the water quality?
Yeah, sure. Gary, can you do that? Gary, can you let us know who you are?
My name is Gary Litherland. I'm with the Department of Water Management. I'm not intimately familiar with this particular situation, but I'll be happy to take it down and get back to you a little later with more detailed information. Typically, if we're doing, let me try to understand this. There's demolition going on at?
Our school is probably within a half block of the redevelopment of the old Children's Memorial Hospital. It's Abraham Lincoln Elementary School. It's on 615 Kemper Pike. So the hospital is in the process of being demolished. About 3 weeks ago, they shut off the water, the water, the electricity, and everything to the school. But parents are concerned with that water being shut off. Is there any possibility that residue or whatever from it being shut off can affect our water within the school? They really just want to know that.
I understand. Okay. Typically, yeah, if there's been a shut off for any extended period of time, they should be flushing those mains as well. We will flush our mains, but if the school has also been shut down, they need to flush all of the fixtures within the school as well once it reopens.
Because the school itself has not been shut down with water, it's just the people across the street. I work at St. Paul's Church, so it's directly across. So when they shut the mains off, of course, for that time period, they were shut down the mains. We were shut down.
They shut the mains off and then they came back on.
They came back on, but it wasn't from, that did not happen at school. That's just a little bit further removed. But when you're talking about flushing the mains, does that happen throughout the process of the demolition? Because it'll be like a 2.5, 3-year project. So is our...
No, what's happened here is the mains were shut down, probably to transfer a main or to reroute it for the demolition, for work to be done on the water mains. They would have been shut down, then flushed, rechlorinated, and then put back into service when they tested. All right. By and large, I mean, the water shouldn't still be shut off to the area, is it? No. So it's fine. So as long as the water is circulating within the water main system, there's no need to continually reflush. Okay.
Other questions?
No, I'm just curious as to when the schedule is.
Yeah, I was going to say, I wanted to answer the second part of your question. Right now, we're really focused on getting the results back. So as I stated earlier, we have results back for 95 schools. So there's obviously a lot more schools that have to come back in. And we've got we have a reasonable sized contingent of people working on getting those results back, making sure that we're quality checking them and that we're getting that information out. And we expect within the next couple of weeks for that process to draw down. And so I would say probably end of July, early August, we're really going to start focusing on developing the criteria for those next set of schools and getting them out as quickly as possible so people are aware. I mean, that's been one of our main focuses in this process is the communication, right? In setting up the website that Forrest spoke of, in getting things turned around in a relatively quick time frame to get the information out to parents, faculty, students. It's been really important. So that's something that is on our mind. I can't commit a specific date, but as soon as we have a significant drawdown in putting results or getting results processed, we'll come back with our schedule for the fall.
And the high schools are the last 59 to be tested.
So we have 59 school campuses that were built after 1986. Those will be prioritized last, and there is a subset of schools in the 146 schools or campuses that we have left that were built before 86 that are high schools. So they'll be prioritized. It's not necessarily high schools and grammar schools at this point. We're going to look at really that 1986 number and prioritize off of that.
So if it was built, so I guess the school was built in 1939, would have a higher priority over a school that was built in 1984. Is that how you're looking at them, or is it?
The 86 numbers, 1986 led
Right.
So anything after 1986 would be the lowest priority because it will not be led in those 5 years.
I'm thinking of Lincoln Park High School was built in 1899. You know, how is the prioritization going?
So after this set of say, the 324 schools, we'll be able to attach a lot more data points to the results that we're getting back, which will then include age, right? So you're speaking of how do you prioritize a school that was built in 1900 versus a school that was built in 1985, you know, and that's something that we're definitely going to look at as those results come back in to try and trend that out and build that plan. And that's why we really wanted to focus on getting those results back in. But as of right now, in the information that we have, there hasn't been anything that has said a school from this era is more likely to have an issue than a school from this era. But if we do find that out, obviously that'll be part of our planning process.
And is there a way of requesting, I know this is a selfish part of schools to ask to be prioritized for the demand, and I don't know if there's that opportunity to have that dialogue.
So there is the opportunity to have the dialogue. I think our response is that based off of the coordination that's involved and obviously with the folks that are collecting the samples and then how the samples are being sent to the labs and then how we're getting the results back and the people that are looking at that information, that when we publish a schedule, we would like to stick to that schedule as closely as possible because of potential logistical issues that could affect other schools down the road. So really keeping to a schedule with the amount of resources that we have and the fact that we want to button down this process and nail it down as much as possible, the less movement we have with our testing process in the schools and the order in which they're due to be tested, the better.
Right, I was just saying the schedule hasn't been set yet. Could a school request to be in the front end of it? That's what I meant. I don't mean like the schedule comes out and we're number 62, then push to be number 5. I'm just wondering if there's any dialogue to be had prior to that schedule.
So yes, I mean, and you can talk, if you want to talk to me after this, yes, I'll take down your information. There were some requests yesterday as well, and I'm happy to discuss those.
Other questions? Last call. Okay, thank you very much. There's literature up here to